Hello and welcome to another exciting episode of Broad Daylight with me, Priscilla Moore. Today on Broad Daylight, my guest is Dr. Benjamin Ba Anim from Gilbert Memorial Herbal Center. He's going to talk today about the kidney and all you need to know about it. There are so many people who have kidney disease to which they don't even have any idea about. Some also have and they don't know what to do. And today we are going to have some meaningful and educative conversation. But before then, do you know that according to the WHO's reports or data published in 2020, kidney disease death in Ghana has reached 4,161. That is 2.38% of the total death. And the age-adjusted death rate is 30.38% per 100,000 of the population, which Ghana ranked 56th when it comes to the world. So when you're talking about kidney disease, it's something that is serious and really needs to be addressed. So my guest today is going to help me digest and expatiate more on what we are supposed to do to improve our kidney health. Doctor, you're welcome.
Thank you very much.
You're looking amazing.
Thank you. The same to you.
Thank you.
You're looking charming.
Hey, that's great.
Yeah.
All right, Doc. So today we are going to speak about the kidney.
Sure.
So can you tell us what the kidney is?
All right. So I want to greet every viewer. Yes, wishing them a great day.
Fantastic.
Yeah. So the kidney. The kidney is one of the essential organs in the human body.
Okay.
Yes, when we talk about the essential organs, they are mostly the organs that are covered.
Okay.
We can talk about the brain, we can talk about the heart, we can talk about the liver, and the kidney is not an exception.
Great.
It's one of the essential organs in the human body.
Okay.
And they are two in number.
Okay.
Yes, they are two in number. They are bean shaped. The shape of a kidney is like a bean.
Okay.
A bean.
Okay.
Then the size is actually like a fist of the hand.
I see.
Yes, and they are located right below the rib cage.
Okay.
And they are at either sides of the vertebral column or the spine or
Okay.
the backbone.
Okay.
So that's the kidney. Is an essential organ, and that's where it's found in the
Okay.
human body.
Interesting.
Yeah.
So is it the same as the renal system?
Yeah, it's the same as the renal. Actually, when we say a system, it comprises of different organs.
Okay.
See, looking at our basic sciences, we know that we grow from cells, a group of cells. The basic unit of life is a cell. Groups of cells makes a tissue. Groups of tissues make an organ. Groups of organs make an organ system. Then we have the living being or the human being. So the renal system it comprises different organs, of which the kidney is one of them.
Okay.
Yeah.
I see. That's fantastic. Now, can you walk us through what the function of a kidney is?
All right. So the function of a kidney is basically two.
Okay.
Yes, it's basically two, and it concerns. It's responsible for maintaining water balance.
Okay.
The right amount of water that the body will need at a particular point in time, and it's also responsible for excreting toxins
Okay.
from the blood. It actually filters the blood,
Okay.
taking away the toxins, leaving aside the one that the body will need again for its metabolic processes. But then aside that, there are other functions that most people are not aware of.
Okay.
And I think one of them is that it helps control the blood pressure.
Really?
Yes. By reason of it controlling the amount of water in the body, its intents also control the pressure in the human body. Because the blood volume, when you look at the pressure, the calculation of the pressure of the human being, it's the blood volume times the cardiac output.
Okay.
Yes. So if we have an increased volume, then the pressure will go up. If we have a decreased volume, then the pressure will come down. Now the kidney is in the position to maintain a balance so that you are not too hypertensive or too hypotensive.
Okay.
So it puts you at a normal place. That's one aspect of it. And it also controls the acidity of the blood. the human blood, the acidity or the basicity of the blood. It also helps in the synthesis of red blood cells, erythropoiesis, because it produces a compound called erythropoietin. And it also activates vitamin D in the human body. And we know that vitamin D is concerned with, bones and the health of the muscles. All these things are essential, and they are all the functions of the kidney.
I see.
Yeah.
So when a patient or somebody comes to your clinic and then the person is suffering from high blood pressure, is it necessarily that there's something wrong with the person's kidney?
It might not necessarily mean that there is something wrong with the kidney.
Okay.
Okay, in the sense that there are other factors that can cause hypertension.
Okay.
Of which a kidney disorder may be one of those factors.
Okay.
So it may not necessarily mean that a person has, a person with hypertension has a kidney problem. But then one of the leading causes of kidney disorders is hypertension.
Okay.
And then diabetes.
I see.
Yes.
But can the kidney fail?
Oh, yeah, definitely. Definitely. The kidney can fail. And we actually gauge it with, we have standards that we make references to. And before we get to the very end stage kidney failure, the kidney will portray certain characteristics or per the measurements, okay, we may know the stage to which the kidney is failing. So the failing of the kidney is in stages. We have the stage 1, stage 2, 3, then the end stage.
I see. Before we come to the stages, can you walk us through what can cause the kidney to fail? Okay.
So before the kidney actually fails, it means certain conditions were in place.
Okay.
Certain conditions are supposed to be in place. And these are basically, I want to group them into two.
Okay.
The acute conditions and the chronic conditions. So with acute conditions, they are sudden, they are abrupt, and they are reversible. And they happen within few hours, days or even, but then less than 3 months. The acute causes that may cause the kidney to fail. Yes, they are sudden. They just happen like that. It's an emergency case mostly. It's mostly an emergency case. And it is when the person or the individual loses enough volume, maybe by reason of diarrhea, by reason of profuse bleeding, maybe a trauma, an accident, and the person bleeds much so that blood is not able to get to the kidneys. You see, every now and then, blood is supposed to be in the kidneys so that the kidneys will filter them. But then when we have a case whereby the blood isn't entering or penetrating into the kidneys, it gets so many, it causes the kidney to malfunction.
I see.
Yeah, it causes the kidneys to malfunction. So that's the acute phase. And because it's mostly sudden, it is easily detected.
Okay.
Yes, it is easily detected and can be resolved. Yes. So, but then with the chronic one, it's mostly undetected.
Wow.
It is gradual. It is progressive. And mostly, before people come into a realization, the kidney has already failed. Yes, that's with the chronic ones. So they are mostly asymptomatic. And that's where our focus is supposed to be.
Okay.
So the kidney can actually fail. And it can be sudden or it can be gradual.
I see.
Yeah.
Wow. Now, let's talk about the stages.
Sure.
What are the stages for a kidney to deteriorate?
Okay, so we have the stage 1, we have the stage 2, stage 3, then the end stage. Now we have a standard. Now before we know the strength of the kidneys, we run some labs.
Okay.
And out of the lab, we check your creatinine levels, we check your urea levels, and from that we are able to calculate the estimated glomerular filtration rate, EGFR. And by reason of knowing this EGFR, we can determine the stages. So when the EGFR is above 90, okay, when it's above 90, we say that the person has a normal kidney, or the person have a kidney failure with increased EGFR.
I see.
That's the normal. Then now stage 1 kidney failure, it's mostly from 60 to 89. The stage 2 is from 30, okay, to 59. Then the stage 3 is from 15 to 49.
What is the normal range?
The normal range is supposed to be above 90.
Above 90.
But even with that, there may be people who have kidney failure, but then increased EGFR, as in above. Mostly it's from, the references are different, okay? But then it shouldn't be above 177.
Okay.
But we can have patients whose DS will go above the 177, some to 200, 300. So, but then when the EGFR is decreasing in number, then you head towards the very end stage of the kidney failure. And you see, I've said that the normal, we have excessive increase. And one of the things we have to also understand is that we don't only use the EGFR to determine the stages, but then it's one that we mostly make reference to. There are other labs you have to run. Yes, so it may be that someone has a very high EGFR and the person is having a kidney failure, but then we will do other labs to confirm it. But mostly when we make reference to the EGFR alone and the numbers are decreasing, the symptoms are very prominent, and it gives us a brighter picture that no, the kidneys are failing.
I see.
Yeah,
So now the
that's
stage
how we
2.
stage. So the stage 2, I said, is from 60 to 89. Sorry, stage 1 is from 60 to 89. The normal is above 90. Stage 1 failure, 60 to 89. Stage 2, 30 to 59. Stage 3 is from 15 to 29. Actually, yes. Then below 15, that's the end stage kidney failure.
That means nothing can be done about that.
Nothing can be done
unless
about
God.
that. So at that stage, we put people on dialysis. And I believe you've heard about dialysis before.
I've heard about it, but what is that?
Dialysis, it's a machine that tends to function like the kidney. So the way the kidney cannot do, the dialysis machine will do it for the person.
And how frequently is a patient supposed to be having that?
It depends on the severity of the condition. So sometimes people can be on it for 3 times a week, 2 times a week, 4 times a week, depending on the severity of damage.
And we have to be grateful for that.
Yeah, so that's it.
So with the dialysis, how different is that from chemotherapy?
Oh, chemo is mostly for cancer conditions.
Okay.
Yeah, whereby there is an abnormal increase in the cells of the body. So they use chemicals to suppress the growth of these cells. Yeah, so that's chemotherapy, a therapy using chemicals.
Wow.
Yes, but then dialysis, it's basically for the kidneys. When the kidneys fail, then it takes over.
Wow. I think there will be signs and symptoms that somebody would notice and see there's something wrong with me, because I believe that what happens to us in the physical communicates what is happening in the inside, right? So can you tell us some of the signs and symptoms of kidney disease?
Okay, so before we come to the signs and the symptoms, or I should say that the signs and the symptoms, they depend on the cause.
Okay.
They depend on the causes. So let's take some of the causes and we look at the associative signs and symptoms. One of the causes of chronic kidney disease or kidney diseases, my focus is on the chronic one because it's gradual and people don't really know, they are ignorant about it. In fact, the CDC made a particular analysis in 2021 in America, and they said 9 out of 10 people with chronic kidney disease don't know that they really have chronic kidney disease. 9 out of 10. And even with that one, those are the severe stages of the chronic kidney disease, 2 out of 5 are not aware of it. So I'm very much concerned about the chronic ones. And now, so the chronic ones, some can be infections.
From where?
Urinary tract infections,
Okay.
bacterial infections. Now, looking at the renal system, urine is made in the kidneys, it passes through the ureter, gets to the bladder, and when the urine accumulates to a particular volume, you feel the urge to urinate, then you pass it out. Now, bacteria can actually infect any part of these organs or this system. It basically starts from the urethra. You see, the urethra. That's where you actually pass the urine out from the body. Now, when there is an infection over there and it is not addressed, it can climb up to the bladder.
How does the infection get there in the first place?
Oh, it can.
Are there places that we go or things that we do that brings about this whole infection?
Oh, the infection can be from, people not being hygienic. People can be there, they won't wash their hands.
Nigga.
Yes, it can happen like that. And basically with women, because when you look at the anatomical presentation of the renal system of a human, they are kind of very exposed to the environment, to the outer environment than men. You see, so mostly when a group of women tend to use the same washroom, the possibility that they will be infected with the bacteria is very high because they are kind of exposed to the outer environment more than men. So even the washroom that people use can actually make them prone to have this UTI or this bacteria infecting them. And when you have a bacterial infection, there are certain signs and symptoms you see. You have dysuria, that's painful urination. You have urine frequency, like small time you want to wee, small time you want to wee. And sometimes you may even have oliguria, like small urine. You urinate small amount of urine, and then you may feel feverish, and you have lower abdominal pains. You see, and when this thing is not addressed, now it may climb up from the urethra to the bladder. You see, then the bladder gets infected, then to climb up again to the ureter, then finally into the kidneys.
Jeez.
Yes, where we have pyelonephritis. You see, and as a result of that, we can even have glomerulonephritis. You see, all these things are infections, and when they are not addressed, it can cause a very fatal, problem to the human being. So infections are one, and with the infections, these are the signs and symptoms: painful urination, frequent urination, low abdominal pains. You see, and one of the, as I said earlier on, one of the major causes, of kidney disorders is people who have hypertension and diabetes. You see, and unfortunately, hypertension is asymptomatic. When someone has hypertension, the person may not know. Yes, the person may not know that he or she has hypertension. The only time you may know that you have hypertension is perhaps maybe you go for a checkup and they just check your BP and it's very high. Then they put you on BP profile. Yes. Or sometimes it's asymptomatic, but then sometimes people may have increased headaches. Yes, easy fatigability. Small time when you do something little, then they are tired. You may have dizziness. You see? Yes. And considering the hypertension, now looking at the upsurge of this kidney problem in our society, I believe that certain things are ongoing even amongst the youth that we are not giving attention to.
Like what?
Yes, that's what I want to address now. Now, the use of certain things, certain drugs, may cause people to have hypertension. Now, considering the upsurge of this idea about sex everywhere, on social media and everywhere, how we are marketing sex is causing problems unawares, in the sense that now a young man will want to have sex with someone and will go in for Aphrodisiac. Now, what these aphrodisiacs do is that they dilate the blood vessels in the penis.
I see.
And by reason of that, it means more blood has to be pumped into those vessels. And now this puts extra pressure on the heart in order to pump the blood. I hope you get it. So it increases the pressure in the heart, hypertension. So the more they use these aphrodisiacs, the more they use it, it puts more pressure on the heart. And eventually, hypertension will set in.
Wow.
And when hypertension sets in, the blood vessels that are supposed to send blood to the kidneys, they become kind of strict. They become, they lose their elasticity. So the amount of blood that is supposed to enter into the kidneys, for the kidneys to function as it has to, will be reduced.
Wow.
And by reason of that, when the processes goes on, I said it is gradual. So the more you use the aphrodisiacs, the more you use it, the hypertension will set in, and you wouldn't know that you have hypertension. Then you see, by the time you know that you have hypertension, perhaps the kidney has already failed.
Wow.
And when it fails, mostly what people see is bipedal edema, the swelling of the feet.
I see.
Yeah, massive. Some can be very massive, and those ones we even call it pitting massive bipedal edema, so that you can even press it.
Jeez.
Yes, you see, and you may even have, it may even, I mean, the fluids may accumulate. You see, it's the edema is actually accumulation of fluids.
Okay.
You see, because the kidneys have failed, now they can't bring the water out. You see?
Why they can't really?
Not that they can't really per se, but you see the metabolic processes that have to go on in order to filter the blood will be compromised. So
Okay.
you see fluids accumulating at the interstitial spaces in the human body.
Wow.
Some may even have ascites. Their stomach, their abdomen will be very big.
Like Oshoko.
Yeah, so that's it. It's very bad. So that's aphrodisiac. And also recently I read an article and it said oral contraceptives. Yeah. So looking at the upsurge of sex, and now people don't want to get pregnant. At least the standard of living is increasing. So you see the average female who want to have sex with a partner will go for oral contraceptives. The more they take these oral contraceptives, okay, from the article I read, the progesterone and estrogen in these oral contraceptives are able to increase blood pressure. Yes. And the when you look at the mechanism of action, it actually affects what we call the RAS system, renal angiotensin aldosterone system. It's a system in the kidneys that checks or tends to correct the changes in pressure in the human body. So when there is a low pressure, the system is activated to increase the blood pressure to normalcy. You see? And when the blood pressure is also up there are other mechanisms that will come in to distort the RAS system. Now, when people tend to take more of these aphrodisiacs, what it does is, the oral contraceptives, it does is that the progesterone or estrogen is able to increase the RAS system abnormally. Yes. So you see that the pressure will go up. And people are not aware of this. You see, it's a whole lot. It's a whole lot. And these things are very bad. And they have to be addressed. We have to correct them.
So
we have to be careful.
The men are not safe. The women
Men
are not safe. Oh my God.
Oh, but that doesn't mean that people should stop taking oral contraceptives. I'm not against family planning. I'm not against all those things. But I'm just presenting truth to people. That even before we go in for all these things, we should at least meet someone who is a health professional, you see, who may address all these things. And the other cause of chronic kidney disease is diabetes.
Okay.
Diabetes. And mostly with diabetes, people present with some symptoms, so it can be detected. So the symptoms they may come up with is that they may have polyuria, they urinate more volumes of urine. Yes, you urinate more volumes of urine. You easily get thirsty. You get thirsty more frequently. That's polydipsia. And you lose weight. When you have diabetes, you lose weight. And when you sleep before the break of day, you may have nocturia. That's urinating more than 4 times before the break of day. So when you see all these signs and symptoms, it may point to the fact that you have diabetes. That when it is not resolved, it may end up in your kidneys failing. You see, and when the kidneys fail, you may have this bipedal edema, facial puffiness. You may have facial puffiness. Sometimes you see people as if they've been beaten. No, there is something going on with their kidneys. You may lose weight and what have you. So there are a whole lot.
Doc. Doc, it's like education is not really going on well, and I am very grateful you are here to tell us all these.
Sure.
There are certain things that we don't really take serious, and it's by the time you realize you are just out of the world. Meanwhile, there could have been a solution to the problem you're going through. So I'm very grateful that you are here to educate us.
Sure.
Now I want us to move on. So how can we curb the surge of kidney death in Ghana?
Okay, so I think one of the ways we can do that is what we are doing now.
Exactly.
Education. Education. People have to be educated. We have to bring truth to people. Now, even the use of painkillers. Specifically non-steroidal anti-inflammatory drugs, NSAIDs. You see, I don't want to mention some names.
Products, yeah.
Okay, but these NSAIDs are able to cause so many problems to the kidneys.
I see.
They may, when you are someone who is fond of taking these painkillers, okay, you may end up creating more injuries to your kidneys. And you may not know initially, but then before you realize, your kidneys are failing. NSAIDs. And there is some perception about herbal medicines being the major cause of chronic kidney disease. That assumption is not justifiable. I mean, researches have not been made to affirm that. Okay, in the sense that now we know from research that the leading cause, hypertension and diabetes. But then the problem we have is that, one, most people tend to take herbal medicines without meeting a medical herbalist.
Overdose.
Not overdose per se, but you see, the condition may be there. Let's say the person will be having hypertension, or let's say diabetes, and the person will just go for the medication. Maybe the person will hear an advert on TV that this medicine is good for pressure. The person will just go for the medication, and the person will be taking the medication. Meanwhile, the medication may not be working as it's supposed to be. In the sense that if perhaps this person had met a medical herbalist, he would have known how to manage the condition for the person for effective therapy. But these people will just take the herbal medicines, and when they report to the hospitals, when the kidneys now fail, that's when they begin to see the signs and symptoms: massive bipedal edema, facial puffiness, general weakness. Then now they report to the hospital. You ask them, what do you take for your condition? They will say herbal medicines. Meanwhile, the problem is not from the herbal medicine, but the condition. Secondly is the overdose. I hope you get it. Yes, it's not, in as much as we are saying that some orthodox drugs can cause kidney failure, some herbal medicines can equally cause kidney failure. There is one scientist called Paracelsus, and he says something that all drugs are poison. What actually qualifies a drug to be drug is the right dose. I hope you get it. It's the right dose. But mostly, even in time past, we have this, our grandparents, they used to take herbal medicines. Sometimes a full cup, they just drink it. But even then, we weren't seeing anything really happening to them. They were even living longer. And it's because herbal medicines have a wider therapeutic index or therapeutic window. Now, this parameter is used to measure the level of toxicity of a drug. The wider the window, the more safer. The smaller the window, the more toxic. I hope you get it. So it's because herbal medicines have a wider therapeutic window. That's why our grandparents were taking any dose and they were even fine. But then time has elapsed, and more education has come into being. And now we have scientists who now give us the right dose.
Exactly.
I hope you get it, of herbal medicine. So if, as at then, people aren't having problems, how can people have problems now? So that's just one portion of it, education. Then lifestyle changes.
Okay.
Lifestyle changes. The food we eat, okay, are certain habits. You see, now we are making reference to the hypertension and diabetes. So things that can cause hypertension and diabetes, you make sure that you curb them. You make sure that you advise yourself.
Okay.
I hope you get it. So you eat healthily, eat more green foods, exercise more. You don't eat late at night. Sometimes when people feel the urge to wee, they will just keep it. They'll keep it for longer periods. It's not good, because the more urine accumulates in your bladder, the more bacteria also increase. The amount of bacteria in the urine may increase. I hope you get it. Yes, and as they increase, the infection is going to be a possibility, and it may worry you. So when you feel the urge of urine, you just pass it out. So that's some of the lifestyle changes. Drink enough water.
Oh, talking about water, before we talk about water, let's watch this particular video of a doctor who is speaking about how important water is to the kidney.
All right.
It is only secret. A bassa, or just on the mapa.
All right, so he was basically saying that water is what cleans the system. How true is this?
Well, yeah, it's very true, in the sense that looking at the metabolic processes of the body, after the body is done with everything it's supposed to do, toxins are generated. We have wastes.
Okay.
Just like a car with an exhaust pipe where the fumes pass through. If these fumes are closed, it may affect the engine. So what water does is that it helps in cleansing the waste. Some of them are supposed to be dissolved by the water. So the water makes sure that it dissolves them. And now you've been hearing about renal stones, like kidney stones. This accumulation of minerals like calcium, like urea. So we have calcium oxalate, we have uric oxalate. They are stones. You see, and they actually occur when the amount of these materials are more than the volume of fluids or water that is supposed to dissolve them. So the more you drink water, the more it dissolves these things, and the possibility of stones forming in your kidneys or any part of the renal system is reduced.
Okay.
I hope you get it. It's reduced. So that's one aspect of it. And also, drinking enough water helps maintain a normal body pressure, blood pressure, sorry.
Okay.
You see, and I said that blood has to be in the kidneys frequently in order for the kidneys to function well. So the more we take enough water, the more we increase the blood volume. And when blood volume is increased, we are sure that the kidney is going to have enough blood. You see, the kidneys itself they are cells. The basic cell of a kidney is the nephron. The nephron. These are cells, and they will need some component from the blood to function themselves, aside filtering the blood itself. So the more we get the blood over there, the more they get the essential nutrients they will need to now filter the blood. You see.
I see.
So that's one of the things, and it also helps in maintaining a good electrolyte balance. Yes, more the electrolytes in the human body, like sodium, potassium, calcium, chlorine, and whatever. The water helps in maintaining balance of electrolytes.
So you should drink a lot of water.
Oh, yes. We have to drink a lot of water, at least about 2 to 3 liters of water a day.
Wow.
Yeah.
I see. So what is your final word? What are you going to say to somebody watching us who is suffering from kidney, or who doesn't go for regular checkup, or who doesn't asymptomatic people?
You see, and you said something now which is very profound. Regular checkup. Regular checkup. Because some of these things we've mentioned are asymptomatic, you may only see them when you go for a regular checkup. So I'll stand in the light of that and tell people, go for a regular checkup. At least once a year or twice a year will be enough. Get your entire system checked up. Okay. And those found of self-medication, it's very bad. At least when there are some inconsistencies in your human body, make sure you meet a doctor so that they address everything for you. They help you with the right medication. People have to change their lifestyle, eating junk foods, eating anyhow, eating late at night. We have to stop doing all those things. And moreover, now I read an article also, and from the British Heart Foundation, I think they said that smoking 1 hour of shisha is tantamount to smoking 100 sticks of cigarettes. But it's unfortunate that the youths are being told that shisha is far better than cigarettes. So I've been seeing most of my friends, most of my colleagues, and it's unfortunate. They are into smoking shisha, thinking that it won't hurt them. The nicotine, carbon monoxide, and other compounds in the shisha is very harmful and can damage the kidneys, according to researchers. So we shouldn't just take anything now. And mostly also social media, people tend to do things by reason of what they see on social media. So when they see I want to grow lean, so they will see certain concoctions, certain combination, take this, take that, and they'll be doing it, they'll be taking it in their system. So my final words is that let's be conscious of what we take within, and let's be conscious of how we live our lives. Preventive medicine is far better than trying to cure a medical condition. So let's be very careful. Yeah.
I don't know plenty. So as we continue taking the shisha, and continue using aphrodisiacs, you come and meet doctor, and then you come and tell us that your kidneys are failing you. Why? And continue following social media. You want to do slimming course. If it overs you, me, I'm here. Thank you so much, Doc, for this wonderful education.
It's my pleasure. It's my pleasure.
Wow. So when somebody wants to come to you, how would they get you? Do you have any social media handles?
Oh, yeah.
Okay.
We are from Gilbert Memorial Herbal Center.
Okay.
Yes. On Facebook, you can meet us on Gilbert Herbal Center.
Okay.
And so is it on IG.
Okay.
Gilbert Herbal Center. And on Twitter, it's G_Herbal Center.
Okay.
Then numbers.
Okay.
055-2428-937.
Okay.
Or 020-9559-216.
Okay.
Yeah, so 055-2428-937.
Okay.
Or 020-9559-216.
Interesting. Where are you located?
We are at North Kanishi.
Okay.
Ogu Road.
Okay.
Near Sakura Junction.
Okay.
Yeah. So anytime anyone wants to talk to any doctor, I'm available.
All right.
We are there for them.
Fantastic. Go and get your kidneys checked.
And we have all the medications to help them at any point in time.
Exactly.
Yeah.
So please go and get your kidneys checked. Why? I've been in the studio with Dr. Benjamin by Anim from Gilbert Memorial Herbal Center. We spoke about the kidney extensively today, because the rate at which people are dying of kidney disease it's serious, and it's quite unfortunate. And I believe that you've learned the reasons why people die of kidney and they were not even aware they had kidney issues. So please, let's all be safe, and then listen to this particular interview over and over again, advise ourselves and our friends and loved ones so that we can all live long. Some way. Anyway, thank you so much for watching this particular episode of Broad Daylight. This show is proudly sponsored by Endpoint Homeopathy Clinic. If you're suffering from stroke, diabetes, infertility, and any chronic disease, kindly find your way there. They are located at Accra, Spintex, Tama, Kumasi, Techiman, and Takrade. locate. That's where you're going to locate them actually. You can also call the doctor himself, Dr. Edu Watson, on 0244 867 068. 0244 867 068. Follow us on our social media handles. Facebook is CMGA TV, YouTube CMGA TV, Instagram CMGA TV, and Twitter at CMGA TV. Log on to our website for more authentic stories, cmonline.com.gh, authentic online news portal. CM Online Radio is here to serve you with more soothing music. CM Online Radio, authentic online radio. Until another exciting episode of Broad Daylight, my name is Prismore. Peace, love, stay out of trouble.